Hey Denver, here's what's happening in your city now. On Monday, August 2nd, Mayor Hancock announced a new public health measure in the fight against COVID-19.
After considerable deliberation and consultation with public health experts, including my Chief Public Health Officer, Executive Director Bob McDonald, I am approving a far-reaching public health order mandating that all city employees, as well as private sector workers in high-risk settings, be required to be fully vaccinated against COVID-19 by September 30.
This includes, but is not limited to, all city employees, teachers and staff in private and public settings, healthcare workers, first responders, and staff at shelters for those experiencing homelessness within the borders of the city and county of Denver. This order comes amidst a recent rise in cases of COVID in our city. Since June 20th, new cases in Denver have tripled. In the past 6 months, 96% of those hospitalized with COVID were unvaccinated, with 90% of those cases being driven by the highly contagious Delta variant.
Most recent kind of information that's come out has shown that this particular variant is very, very contagious. More contagious than some of the other viruses that we have dealt with. The data right now is showing that patients who are unvaccinated are at higher risk of, much higher risk actually, of severe disease than vaccinated patients are.
Thus, to help curb the continued community spread of COVID-19 and the Delta variant, the city is deploying its most effective public health measure.
While masking and social distancing are important tools to protect those who have not been vaccinated and may even be useful for particularly vulnerable people who've been vaccinated, the truth of the matter is that these measures are no substitute for what we need to shut the virus down for good. More people vaccinated.
We have been for a year and a half now. We've ordered face coverings to be worn. We've had a series of testing regimens. We've tried a stay-at-home order, and we've tried capacity limits. We've tried all of those things, and a year and a half later, after all of that, here we are. We have a virus that's mutated to the point where those things are becoming decreasingly effective. The only thing that's going to get out of this is mandatory vaccinations. We are not going to mask our way out of this. We are not going to test our way out of this. We need to get people vaccinated. That is the only way that we're all going to pull out of this.
The simple fact of the matter is that the pandemic is not over, and the virus can severely affect anyone at any age. Early on, the virus appeared to primarily affect our older and more vulnerable populations, but that is not the case anymore.
But what we're seeing now is a lot of younger patients are coming into the hospital with severe disease who have not been vaccinated.
But no matter who it infects, the effects of the virus can be devastating.
I've seen families that have to say their last words to the loved ones who are really sick, patients going on ventilators and not coming off of them. So it's really been devastating. And so the faster we get beyond this, and so the families don't have to suffer like this and people don't have to suffer like this, the better.
There is a lot of misinformation and hesitancy surrounding the vaccine. The city will work with employees to inform and educate them on the safety, efficacy, and benefits of the shots.
We're going to start with working with every employee who has questions. The goal is compliance. The goal is to get people vaccinated, to create a safe working environment for not only city employees, but for residents and customers who come in, and also for our contractors who are interacting with us as well.
But education about the vaccine is important for all, whether you're subject to this order or not.
I understand why some people are hesitant. In this particular case, I would say that the vaccine was actually really well studied. Large clinical trials were done on this. They were done the right way, especially looking at people of color. People of color were definitely represented in the trials. That all those things make me feel good about the way this was done. But if you go get the facts from your physician and they can really get real information rather than just hearing it from rumors or other things, a lot of which are really not true about these vaccines. And I think that looking at safety, effectiveness of this particular vaccine, I think that when most people look at those numbers, it will make them feel a lot better about getting the vaccine and really recognizing the difference that you're making in the community and helping us get beyond this pandemic.
For more information on the public health order and the vaccines, visit denvergov.org/COVID-19. For more stories and the latest full episode of Your City Now, check out Denver's YouTube page or tune in to denver8.tv.